All right, everybody, it is 1:01. So I want to go ahead and get started. Thank you all for joining us for our December quarterly meeting for our self-direction group. We are hoping today, in terms of agenda, we appreciate you guys attending. We were thinking today that we would use the time with you all, kind of do a look back over 2025, the self-direction, what we've used these quarterly meetings for, in terms of review. And then for the second part of our meeting, maybe have a little bit of discussion about how you guys would like to use these meetings future next year as we plan for quarterlies, and then we have questions and we'll probably have time for questions and answers. At this time, we have the meeting set up as a webinar, so all lines are muted. I'm asking, at least for the first part, if you guys have questions, please throw them in to the Q&A box. For the second part of the meeting, I'm hoping that we can open up some of the lines to have discussion, but I'm asking you, of course, if you're more comfortable entering into the chat, we can take questions or comments that way. But if you raise your hand as we move into that discussion portion of the meeting, we can allow you to talk, but I want to try to, I don't want people talking over each other and that sort of thing. So I'm hoping we can sort of raise our hand, give that person the floor, and then we can sort of shift that way. General questions and feedback, you can also email those to our OCDDHCBS@la.gov email. If we don't get to it today or answer it today, you can always send questions to that email box. And we will post this slide deck after this meeting. And then we will make sure we get notification out so you all know that information has been posted. The DD Council have been super partners in helping us get information out to everyone. So we'll route that through various spaces to make sure people know that we've posted that information. All right, so the first part of 2025 for our March quarterly meeting, for those of you that were able to join, we did use that first meeting to talk about service documentation. OCDD developed and provided a standardized note option. We shared that with those individuals and families that are accessing self-direction. We provided documentation content that is required for that in-home documentation. So we shared with you all during that session, even if you don't use the standardized note, that we shared what content was required to meet the requirements for in-home services. We utilized our time together in March to conduct that training session and answer questions. And then we did publish those training slides and the training videos on our website, and I've got links in here. So once we get this out, these will be clickable links and you guys will be able to tap those to get to that information. So that was what we did for our first quarter meeting. In June, we used that session to talk with you all about critical incident reporting. The information that we covered during that session was about the instructions, the operational or process instructions that OCDD has in place around critical incident reporting. That session also included information about rights and responsibilities, the roles and responsibilities of all of our different entities in critical incident reporting. We shared with you all the purpose and the reason that we report critical incidents, how it's something that with our CMS waivers we have to do in order to assure health and safety. We talked about the different types of reportable incidents, and we were able to share examples and detail and descriptions. I say our quality team really led this up and did a super job. I included at the bottom here a bookmark that'll take you to the links where all of our presentation and all of our critical incident information is housed. In addition to The presentation, the other information around critical incident reporting. We've also developed sort of a quick reference guide, a one-page sort of flow that we hope is useful and helpful to everyone. That's posted on our site, and we've been trying to share that through various mechanisms in order to make sure that you all have easy access and something that you can quickly reference to know what your responsibilities are, what needs to happen as it relates to critical incident reporting. Oops, sorry, you all. Last month, or September, I'm sorry, last quarter, we had a couple of topics that we covered during that meeting. We had the first part of it, we had Qlarent come and do a presentation regarding the National Core Indicators. They shared with you some of the processes or shared with you people may be contacting you to participate in upcoming surveys about your experiences with our waiver and service options. We also did an overview of the changes that we were working on with the self-direction manual. And so some of the areas we covered in our meeting last time were really related to, we have general like cleanup sort of stuff in the manual where we, cleaned up or tried to clarify or make language a little bit simpler. And then we had larger changes based on feedback that we had received about some information about how to understand and manage the budget that's in the CPOC. We talked about involuntary and voluntary discharge criteria. There's been some updates related to electronic visit verification and requirements around that. We updated language, and we're going to make sure the links and the information we've shared in training will be included in the handbook related to service documentation, and then a few updates to employer responsibilities. Some of the feedback that we got from you all in our last quarterly meeting included, I think I had 3 or 4 of you, it was kind of exciting, share with us that it would be really, really helpful to have quick reference sort of sheets or cheat sheets to know what needed to be done right before an annual or for initials or initial plan of care or things of that nature. We took that back and we did develop couple of options that I'm going to throw up here, and I'm hoping you guys will give me some comments in the Q&A box. We came up with some checklists like the quick and dirty sort of what's the date of my meeting, and so that you're able to sort of write that in. 90L completed, ways to apply. So this is for an initial plan of care, and it sort of just hits sort of the big ticket items that you would want to be sure were completed as part of that initial plan of care process to access and enter self-direction. It's draft, and so you can certainly give us comments today, or when we post it, you can give us comments, or when we circulate the handbook, we'll have that as part of it. You guys can give us comments in a variety and feedback in a variety of ways. But this is what we were looking at in terms of the initial plan of care. We looked at, it's very similar to annual plan of care, but we did try to distinguish between those two activities. I'm going to leave it up for a second and pause. And then lastly, one of the other things that we are thinking and proposing that we put together is really sort of taking out having a quick guide in terms of the roles for support coordinator, self-direction employer, fiscal employer agent, and having that as sort of an attachment. So again, these are draft proposed options. They'll be included in the deck when we post it. Open to feedback if you want to put it in the Q&A, or feedback if you want to send it to the OCDD HCBS email. But these were some of the things that we heard you all share with us in the last quarterly meeting. I'm going to pause and give a minute if anybody wants to put anything in the Q&A box. So one of the things we really wanted to use our time today with you all, the bulk of our time to kind of talk about and think about, are how we sort of use these meetings, our quarterly meetings, moving forward. How you guys want to structure. So, what information do you all want us to bring? What's most helpful to share in these larger self-direction quarterly meetings? Are there training opportunities? Do you want us to look at similar things that we did this year to this year in terms of we did that documentation, we did critical incident reporting? And if so, like what kind of topics would you like for us to cover? Are there other areas or logistics or things about how we structure these meetings that you would like us to consider or think about as we move into 2026? So I'm going to pause and we're going to approach this a couple ways. If you would prefer to come off of mute and sort of be able to share with us what you think makes sense in this space, then we can, if you raise your hand, we can let you talk. If you want to put it in the Q&A, we'll take it that way. You guys let us know. All right, I'm seeing I've got Brooke has raised her hand. And so, all right, Miss Brooke, what do you have for us?
Hi, good afternoon. So this is my first meeting and I've been on self-direction, I feel like for about a year now. So
Okay.
I do want to say I wish that I knew that if the meetings could be shared, I guess from our care coordinators more, our case management,
Okay.
so we know that the meetings are happening. And then the other thing I shared is that just like the mandatory items that we need to have so we can stay in compliance, I think is like the most important things that I would like covered.
Okay, if for some of the training topics.
Yes, ma'am.
And then logistics with getting information out. So we have several different routes that we use to get information out, Miss Brooke, but we'll look at what additional options. So we send the information out through the fiscal agents. We send out all our bulletins to support coordination.
Okay.
We've partnered with the DD Council. They've been great at helping us get information out. And then we do post it on our website, but we can certainly, and open, if you guys have suggestions and want to email it to us, we're open to.
Yeah, I think those are good. I guess I never realized that I had these were it's just a lot to remember. So now I know that I need to be attending these meetings, but that's how I found out through the DD Council.
Gotcha. Okay, thank you, Ms. Brooke. That's helpful.
Christy, this is Janae. We had a question about how do we get a new EVV fob as ours has quit working. I would encourage you to reach out to your fiscal employer.
Yep.
Employer agent, either Morning Sun or Acumen, to get that resolved for you, Ms. Tamara.
All right. Miss April, you should be able to come off mute and share information.
Hello, can you hear me?
Yes, ma'am.
Hi. So I would just like to just make y'all aware. The support coordinators, they are just not all trained the same way. I have a support group that I've had for about 4 years for parents of children with special needs. And, I hear all kinds of complaints about the support coordinators. And it's great to have these meetings and to, tell the parents and the employers what they're supposed to be doing. And that's great to educate them. But the support coordinators need to all do the same thing. They need to be, coming to the homes, making the employer be there, making the whoever else is in charge, caregivers, whoever they need to be there. And I hear that they some of them don't do that, and I don't think that's right, because there's been cases before where there's a client and no one ever puts their eyes on the client, and that's not right. If the person has a waiver, that support coordinator needs to be putting eyes on that client. About at least 4 times a year. I mean, and they're just these different companies. It depends on your company you pick, and then the support coordinators in that company still do things differently. And I think there's a big need for retraining those support coordinators, because I hear a lot of things that should not be going on, and I just want to make y'all aware of it.
Thank you, Miss April. So we'll take that back. We've got a couple different areas that we're working on, internal to state office, on some procedure documents, procedure manuals, things so that we can try to shore up some consistency across areas. So I think that will hopefully address some of the things that you've raised. And then we will look at what kind of training and what other opportunities we need to offer to all, right? To all accessing self-direction and who may need some additional training. So I appreciate that, Miss April. Thank you.
Thank you.
Okay, I'm gonna bounce between things a little bit, because I see, well, or maybe I'll hold Miss Tamara and we can talk about your question in just a minute. I'm just looking through the questions real quick. The past meetings that are available to see, the DD Council again have been great partners. So they usually record these sessions for us, and they do post them on their YouTube, and we usually try to link back to that so you all can see those recordings. For some of the training that we've done, like for example, specifically the documentation, we have a training, we have that in the slide deck that I'm going to make available to all of you with the clickable link that you'll be able to go back and watch a recorded video of that documentation training. JC Paulsell, I don't want to massacre your name. I've unmuted you if you would like to share.
Okay, can you hear me?
Yes, ma'am.
My name's Christy as well, and you spell yours correctly as well. So thank you.
All
It's
right, Miss
refreshing to see you like mine's out there. I just like to remind all parties, and I've been on self-direction since 2013. And in a now waiver since 2010. So I try to consider myself a veteran in going through all this, but that saying, I almost missed by 2 days the renewal deadline for Medicaid. So reminding people that just because you are on a self-direction plan of care, you are not automatically renewed to Medicaid. There is not shake hand, right hand, left hand knows what they're doing in this organization, it seems like. So that was a very frightening experience for me to have to go through with my daughter. Her plan of care is kept diligently, progress notes, which we love the new progress notes. The caregivers are saying there's a lot more space to express what's going on than I had provided previously. But the fact that they are not linked together, the plan of care, the home and community-based waiver plan of care is not linked to an automatic renewal with Medicaid. So be very careful with that, people. It was a scary moment last month or this month. Thank you.
Thank you, Ms. Christie, for sharing that information. And then Janae Lavasha, maybe we can also make a note, if we didn't already on the checklist, just to remind people to maybe check their Medicaid. And we'll look for some other opportunities, Ms. Christie. I appreciate the feedback.
Thank you. Unmute.
Oh. All right, Ms. Karen.
Hello,
Hey,
can
Ms.
you hear
Karen.
me? Hi, how you
Yes,
doing? I have a
good. How are
couple of questions. My son, he's on the now waiver and we are self-direct. He's been on it now for quite some time. He just made 30. He's been, probably since he was maybe 10 or 12. Anyhow, I have a question on the notes. In the past, all of my caregivers have always just written their notes on loose leaf paper and put it in the binder daily. I just recently have noticed that now there is notes up on the website for us to print out to use for notes. Now, is that mandatory that I have to use those specific notes now, or can my caregivers still use loose leaf as we've been doing?
You can continue to utilize what you've been utilizing, Ms. Karen, to take to document services. But
Okay.
whatever you use needs to you have to make sure you incorporate the elements that are required for our service documentation. So whatever format you use, you just have to make sure it meets the elements and the criteria for what we have in place for service documentation. And that's included in the training materials that there's a link in
Correct.
here. You'll be able to check that out. Okay.
Okay, thank you.
Uh-huh.
Any questions? I have my caregiver here with me. I just want to make sure, see if she has any questions to ask. Anything? That was it? Okay, and I heard what the last person said about Medicaid, about renewal for Medicaid. I've never come across that problem. Mine's always, for my son, has always been just renewed through the support coordinator. So I don't know, I guess it's something I need to follow up and check in on, but every year it seems like it's just been automatically renewed. So I don't know if it's something my support coordinator has just done for me automatically when we have quarterlies or whatever, you know. Um, but I
So
need to check into that, I guess.
they usually send out, I think, a letter. Is that correct, Janae or Lavasha?
That is correct, Christy. So I'm not sure if you've received a letter from Medicaid telling you what to do for their annual renewal. I don't know if you've ever received anything. Your support coordinator could certainly assist you, but have you received any notification?
No, I haven't. I have never received anything. Now, I do yearly get a thing from Medicaid stating that he has been renewed automatically for the new year. Like they'll say he's still, you know, approved, covered, but he's also on disability SSI, you know, so I don't know if maybe they do it automatically or not.
Hmm.
But I've never received anything in the mail that I would have to do a renewal on. So
think
that's
Miss
quite odd for, you know.
Miss
Christie,
Miss
yeah, go ahead.
Sorry, go ahead. I was gonna say, I think Miss Christie just raised her hand, so I wasn't sure if she had something to add, because I know she raised the Medicaid, so I didn't know
Uh-huh.
if it was related to that, Miss Christie. Also,
Oh, okay. Well,
Kim,
anyways,
go ahead.
I guess
Well-
it's just something I'm gonna have to check into, you know, because I've never come across that problem before.
So
Kim?
Yeah, this is Kim. I work for Christy and Janae. Um, there are some individuals that do get renewed automatically, but that may not always be the case. So if you always be on the lookout for a letter, uh, if you get something that says it's time to renew your Medicaid, please follow through. It's
Okay,
not just an arbitrary letter. Some do happen automatically, but it could happen automatically for 2 years, and then the third year you get a letter.
gotcha.
So there are different timings for that. So please, please, please pay attention to any letter you get from Medicaid because that means you need to do something.
Okay, thank you so much.
Yes, ma'am.
I'm gonna jump over to the Q&A box. I'm gonna lower attendees' hands because I think, unless Miss April, you have something else to add, I was gonna lower attendee hands so I know who's waiting to talk. All right, Ms. Tamara, you asked what all can our budgets be used for, home modifications, diapers, etc. So for this particular question, for self-direction, the services that we allow to be self-directed are really your personal care, IFS types of supports. If you're talking about your broader waiver budget, then you would be able to utilize that budget to access those other options. So I don't know if that answers the question or if you have additional information to add so that we can make sure we answer the question. I'll give you I'm gonna give you a minute to respond. Looks like we have a recommendation or a request to get more info and guidance on moving into services for 21-year-olds and beyond. So maybe some additional training opportunities for our youth that are moving into adulthood, transitioning into adulthood. I think I answered Miss Galen's question. We have another recommendation to have resources to help train DSWs on professionalism. So we'll make note of that. Are there new changes for 2026? What we're really trying to get out for you all in early 2026. I don't know that there's other changes at this point in time. The big thing that we're trying to finalize and get out for you all will be related to that handbook, getting that out so you guys can give us feedback on ease of reading, usability, if it helps answer questions. And then at this point, that's sort of where we're at. And then obviously what we hear from you all and stakeholders sort of drives next steps and different things we do in that space, Mr. Doug. Ms. Brooke, the standardized note options, we've got a link in this PowerPoint that will take you to where we have that. Got positive feedback that the Pastor Veronica's support coordinator is great. Training, sorry, you all, it's jumping on me. Definitely agree with the training of the support service staff. And then this is support. I am personally with quality support coordination. I've had over 7 support workers and the level of training varies greatly. So we'll take that back. Thank you. Professionalism, Miss Jamie, she hit return too soon. So professionalism for DSWs, training portal for DSW to access many types of training directly related to helping DSWs who may not be as familiar with advocating for more independence in the community, person first language, access to services, activities. There wouldn't necessarily be agenda items for these quarterly meetings, but sounds like Acumen used to offer some additional online trainings. Thank you for that info, Ms. Jamie, and we'll write down some of those things and see what options may exist that we can share, resources. Miss Vicky, I just want to say that my support coordinator at Community Resource Coordinators is fabulous. She always keeps me informed about what is going on and that you all have been blessed. That's awesome. Thank you. Ms. Chandrika wanted to add to what Miss Christie shared that she's noticing that some individuals aren't receiving their letters for renewal. It's happened to about two of the participants she works with. One most recently, family did not receive, nor did we as the SC agency. All right, so we'll write that down. And if we need to do additional research, Ms. Chandrika, you might have to send us additional information so that we can assist or support.
Christy, could I offer
Janet,
something
yes.
here?
Please do.
Okay, at families, please make sure that if you have moved, you update your address with Medicaid. I know one of the individuals said they get their letter annually that this person has been renewed. So if you're not getting any correspondence from Louisiana Medicaid, you may need to work with your support coordinator on how to go into the portal and make sure your address and contact information is up to date, because that is what they use to send out those letters. So if you move and that information, and you have to update that information, the SC cannot update that. Well, I think the SC can submit a 148 to show that you've moved. So when you move, get with your support coordinator, ask her to update that or send a document to update that information with Louisiana Medicaid. Thanks, Christy.
Thanks, Kim. It does look like there's several items on here related to Medicaid, which kind of makes me think maybe we can have a conversation or speak with our partners at Medicaid to see if maybe that's an opportunity. Maybe there'd be a willingness to sort of attend one of these meetings and present a little bit of information about that process. Kim, Janae, Lavasha, does that make sense? Maybe we
It
need
does.
a
Yeah.
I've
Medicaid
captured it.
item.
I've captured it.
Thank you.
And that makes sense for us to, if possible, get information that we can share on where they need to go and how to make contact if needed. So we'll work on that as well, Christy.
So I think based on some of the questions and feedback we're getting around Medicaid, we're going to sort of note that that might be a really good topic or item for us to put onto 2026 agenda. And then if there's something else that we need to do to help in this space, you guys just let us know. Okay, I think we've got some hands raised. Miss Tamara, did you want to go ahead?
Hi, yes, thank you. So to clarify my question about what can budget be used for, I serve as president for the RAC, for the Northwest Human Service District. And that comes up sometimes, like, I don't think people are aware, and I say people, one, clients, but also the support coordinators aren't always aware how budgets can be used. So I think a training on that. That's kind of what I meant.
Got
like I'm aware, but like sometimes I'm like, did you know I could use my money for this? Or like, what? No, you can't. And then they go back and then they, have to ask. So that's what I kind of meant on that training.
Okay, so broader training topic around that. I got it, Ms. Tamara. Thank you.
Yeah.
What else you got?
And the other thing, because I work under the Governor's Office of Elderly Affairs, and what we get, and this is more, I think, training back from that DSW and those, I guess you want to call them like the provider levels. We get clients that call us and they're asking for supports, but yet when we go in and find out, they have waivers. They are getting caregivers, they're getting somebody in their home, but yet I'm quoting, these people don't want to cook for me. These people don't want to help get me to the doctor. These people don't want to do this. And literally one time it was, we go there and they're like, well, we'll do the caregiver paperwork. I'm not doing this, and this. And again, kind of educating what's required of these waiver providers, sometimes even on self-direction. We have some people who are doing that and they're like, well, I didn't know I could ask them to cook for me. I didn't know I could ask them to take me to the doctor. And it's only because I personally have a son on waiver that I go, yes, you can. I've actually had to get on the phone on behalf of some of these elderly clients that are on waiver to the provider and go, your client is asking for more help, which is basically double dipping, and you know your people are supposed to be doing this. So kind of another training on that side.
Okay.
And who are they reaching
Got it.
out to?
For me, they reach out to me at the Council on Aging.
Council on Aging. Okay,
Yeah.
that's what I was looking for.
Yeah,
Thank
because I
you.
work with elderly. So they're calling us asking for Meals on Wheels, asking for all this stuff. And when we get out there, there's a caregiver sitting there and we're like, okay, well, who are you with? Oh, well, I'm paid for by these people. Okay, well, that's a waiver. Well, I'm not going to do that. And again, now you have an issue. And again, I did have one person, I know this is more self-direct, but we're talking about overall training and stuff. But I had one lady who was self-directed. She's like, I didn't know that I could ask them to drive me to the doctor. I didn't know this, this, and this. And it's like, that's what they're being paid for by Medicaid already. I can't come in there and give you help when it's already being paid for by another entity.
Thank you, Ms. Tamara. Ms. Carey? Ms.
Hello?
Carey?
Yes. Hi, good morning, afternoon. Yes, my
I knew what you
concern
meant.
was with the hours because like y'all have them broken down into quarters and segments with a whole bunch of numbers. And I think they need to be where we could read them as the client or the employer because I had the longest time trying to figure out how many hours my daughter really had until recently when I found out that she was getting 9 hours a day, but I didn't know it. I just assumed she had 8 hours.
Mhm.
You see what I'm trying to
So
say? And she
I
gets
do
7 days. Huh?
So Ms. Carey, one of the things that that was part of the work that we've been doing with the employer handbook is
Uh-huh.
trying to take those units, take those hours and break it
Yeah,
down
units. That's
so that
them.
that's something we're looking at doing and integrating into that handbook. So I'll be looking forward to hearing from you when we send it out for feedback if that's helpful.
Okay. And like the books, the handbooks that you say we were supposed to receive, oh, excuse me, is that gonna be mailed to us or emailed
We'll
or
have
what?
it We'll have it online where you'll be able to go click the link and pull it and save it wherever you want to save it or print it.
Okay.
But
All right.
we'll put out notification when it's ready, when the draft is ready for you all to review,
Okay.
provide us feedback. So there'll be opportunity if you think we need to simplify further, then we'll
Mhm.
be looking for that feedback. That sounds good?
Yes. And to get back with the other lady, I had workers that used to do the same thing to me. They would be in my home and they would tell me they can't cook, they can't clean, they just here. And I'm like, well, what you here for? Just to watch TV? Because that's what they would do. They would sit there and watch TV all day with my daughter, and then nothing would get done throughout the day. Like my daughter had her own room, but they weren't cleaning it. I let that company go. Yeah, because if they're not working for me, they losing my time.
I got you, Miss Carey.
And my daughter
So,
legally blind, and she have to have one-on-one assistant with everything.
yes, ma'am. So making sure that people are educated about what goes into
Mm-hmm.
their plan of care and how staff should
Right.
be implementing what's in the plan of care. We got that. Okay.
Okay. All right then. Thank you very
Yep.
much.
Thank you, Miss Carey. All right. Gonna jump back over to the text, to the Q&A box. So there's a question related to the role of the support coordinator. And so we've included some information in our handbook around that. And then maybe we can partner with some of our support coordinators, Janae Lavasha, and maybe we partner and do some sort of presentation together on their role and how things should work. We can look at doing something around that. So we'll we'll make a note as that might be another training opportunity there. We've got a question about a website address and where people can go online to make sure everything is correct with LA Medicaid. We can, I guess we can add something maybe to the slide deck, Janae, and maybe include some important websites that will help with that.
I think that'll be helpful, Christy.
Okay. Kudos to support coordinator at Solomon North. There is a question about some of the issues or some of the news that's gone out related to United Healthcare. I don't have information to share about that today. I would encourage
Yes, I'm sorry,
people
what
to
was your
reach
name?
out. I'm sorry, Ms. Tamara, did you have a question? I don't have information to share today about that. I would encourage you to reach out. I'm sure Medicaid has a site to send questions and ask questions about that. Ms. Karen was sharing that in our waivers on the OCDD side, there are sometimes some issues, as noted by Tamara, related to staff. So we've made a note of that. And how long do we keep the daily progress notes? Kim, remind me of the retention schedule. Is it 6?
Yes, it's 6 years from the last date of billing. So, for a minimum of 6 years from date of service. And if you do any adjustments to any of your billing, it would be 8 years, 2 years after that, I believe.
Okay. Thanks, Kim. And it needs to be paper or it can be digital. I think you can save it digitally. I think you would just have to be available to print it or email it or share it if it was requested, right, Kim?
That's correct, but remember the progress notes do require the signature of the worker.
Yeah.
So it
So, Ms.
should be,
Brooke, you
it's
might,
got to be something that has a signature on it.
and you might scan it and save it digitally. Or however you're doing that. Ms. Chandrika, I think you got your hand. I think you should be able to come off mute. Ms. Chandrika?
I'm sorry, I was having trouble. I did want to ask about, I know y'all just said that they can be digital, but they must be able to have a signature. Would they be able to, I'd say electronically sign, but you know, like how some people utilize devices such as iPads, that sort of thing, and they can like sign with a pen or their finger. Would that be okay as well?
I would say as long as it's not a typed signature or a cut and pasted signature, it has to be a signature. So if you're signing with your finger, you are signing. Does that make sense?
Thank you.
But you can't cut and paste a signature onto a document. That document has to be validated by the person that prepared it.
Are there any HIPAA compliant restrictions regarding storing digital notes such as in a Google Drive? I don't know offhand. I would have to research. Kim, do you?
All I would say is that if it's my record, I can store it anywhere I want to. If you're storing someone else's record, then you're not a provider. I guess but you are the employer. You would need to make sure that it was probably secure where it could not be accessed outside, that it would be somewhat HIPAA compliant. But I think the HIPAA laws really apply more to providers, physicians. But again, if you're doing it for someone, if you're the employer for someone and you're not their legal representative, then should probably be careful. I don't know if Google Drive is HIPAA compliant or not. I don't think anything on the internet is safe, personally.
Sarah from our office just said Google Drive may not be HIPAA compliant.
Thanks.
Thank you, Sarah. All right, so I think we've gotten a series. Okay, and Miss Karen was sharing that HIPAA applies only for providers using electronic communications to communicate billing and invoicing. Thank you, Miss Karen. All right, so I think we've got a list, and I know my team has grabbed those and written those down of topics or training topics that might be useful or helpful. We talked a little bit about maybe having Medicaid, if they're available, to maybe come do a presentation related to renewals or working with them on some topics there. And I've heard, sorry, I'm reading my notes, y'all. We got some feedback about managing the budget, which we're incorporating into the handbook. And we got some feedback related to logistics and how we get notification out related to the meetings. What other information or how are there other ways that you all would like to use our time when we have these quarterly meetings? I'm coming, Kinsey. All right, Kinsey.
Hi, this is Kinsey. I just thought maybe a good topic to look at in the future would be a little training on having the attachments completed. I know at one point that was a big area of question for a lot of self-direction families, just feeling like they didn't have the training they needed to complete the documents that go with the CPOC. So just an idea. I don't know if that's improved lately or if support coordination has just kind of been handling it. But I know that was a big deal for a while.
Okay.
Thank you.
Thank
And
you.
Christy, I had that as an agenda item probably for our next quarterly for providers. So
Okay.
it's timely, it sounds like.
Other recommendations? Other questions? Are there specific updates that you all think would be helpful? Tina with Acumen indicated or suggested more training on the roles of employer support coordinator and fiscal agent, specifically knowing who does what and who is responsible for certain tasks. So we can certainly look at options to cover that information and work maybe with some of the members of our self-direction advisory group to help us present that information. And Ms. Brooke, we haven't scheduled the meetings yet for 2026. In general, we usually shoot for the last month in the quarter. So this year we did it in March, June, September, and then December. And then it's usually the second Wednesday of the month from 1 to 3 p.m. But we'll work to pull together a schedule and try to get that out in advance so everybody kind of knows it's coming. Maybe we'll do a bulletin to say these are the dates that we're planning, but we won't have all of the agenda outlined yet. Other suggestions? Feedback? I'm gonna pause. I don't know if anyone on my team has anything to add.
I don't have anything, Christy.
Miss Sam,
Okay.
I captured your request
Okay.
on a more solid
Thank you.
policy on storage of notes.
Yeah, let's look, Kim, on what we have, I guess, in our handbook.
Yeah, we don't have anything really about digital notes.
Okay.
But yeah, we need to look at that a little more.
Miss Terry, the DD Council is a fabulous partner. They usually record these for us, and so we will make sure that we have the link for you all to go back and watch this on YouTube. Miss Christie, we don't have a future date scheduled yet. It will probably be in March of 2026. We'll try to get something out so that you guys know it's coming. And then Miss Brooke, where can I get a fob to clock in and out? That's something I believe Janae kind of talked about a little bit earlier. You're going to want to check in with your fiscal agent, Acumen or Morning Sun, and they should be able to assist in terms of the fob. Right. So I'm just pausing to give a few minutes to see if anyone else has questions for us. Tamara, we had that question a little bit earlier. I don't have information to share specific to that. Miss Jamie, and just 1 second, Miss Tamara, and then you can go ahead. Jamie Dawson said she'd like to share in a sense of working together. Pointing fingers never promotes progress. In order to make the process better, everyone has to understand the role they play. We agree, Jamie. I think that was kind of Tina's point too, about being able to pull together training and have some clear guidance on who's responsible for what. So certainly don't want to point fingers or blame at any one particular group. Miss Tamara, I think you have your hand up. You can go ahead and unmute and speak if you'd like. Miss Tamara?
Okay, now I'm muted. So question, since we really don't have a lot of guidance on the insurance issues, we've been having clients reach out to us at the Council on Aging. should they go ahead and try to get another insurance or just wait, quote, until they're contacted? Because some of them are concerned that they may be without insurance after the first of the year for Medicaid.
I mean, I haven't read very much on it, but I think that there was gonna be some work done to make sure people are connected with an insurance company or an insurance, one of the groups. And then they would have the opportunity to switch if they weren't happy with that particular one. But Ms. Tamara, the best option is gonna be to connect with Medicaid. I think they're better equipped to answer the question.
Okay, all right, thank you.
Sure. Kim, do you want to review the digital signature piece again for me on the daily progress note?
Sure. So it really, there's a lot of definitions of a digital signature. What has to happen is you have to have something on the document that gives some level of assurance that the worker actually completed the document and signed the document. So just typing someone's name in is not a signature. So that's not a digital signature. Digital signatures are some of the things we talked about where you can use your finger and actually write your name, or if you have a tablet, you have one of those pens that you can write on the tablet, sign your name with the pen. Or if you have a system where you have to log in with a password and it captures your identity and then it records that on your progress note that this person has, digitally signed this document, where it gives a sort of an attestation that they digitally signed the document. I think you can do that in PDF if you have where you set up your worker actually sets up a password and they would actually sign the document by logging into their system and say, yes, sign my name with this date and it'll give the date that it was signed. It's not something that they can just type in.
Thanks, Kim.
Sure.
And then Tina with Acumen shared that for the fob issue for Acumen, you can contact your agent for a new fob or send an email to enrollment-la@acumen2.net. Janae Lavasha, can we grab that email? Maybe we'll put that as a, one of the resources if we add a page to the slide deck. And then Nicole with South Central shared that more guidance to support coordinators regarding legally responsible individual and self-direction attestation forms it's needed. So we'll look at that as well. Nicole, thank you. Other feedback, comments, questions? If there's something that you all think about that that you think it would be good to have as an agenda item, maybe, not way in advance for the whole year, but as we're coming up on a self-direction meeting, you can always share those topics or ideas in our ocdd-hcbs@la.gov email address. That email's in the slide deck, so when we make that available, that's another option. So as we're sort of going through the year and things come up and there's things that you think would be a good topic for us to talk about, you can always email us there and share those topics with us. Ms.
Can I ask
Karen?
a clarification question about the progress notes?
Sure.
Camera. So on there, it says like community service, personal care, shared support. So like if a client is only in one, like that's going to be the same all the time, right? Or is there like an option for other stuff, I guess?
And so, Ms. Brown, I'm unfamiliar with,
This is
um,
Tamara.
oh, I'm
This is
sorry,
Tamara.
Tamara. I thought it was
Yeah.
Karen. Your name's not popping up. I apologize for that. You said that there's something that tells you on the note itself that it's shared supports or,
Yeah, there's the option, I'm kind of looking, it talks about, okay, relationship, education. Where did I
yeah,
see that?
okay.
Because we were kind of looking at what y'all did versus what we had in place. And that was one thing one of my workers was like, well, they're asking this, but doesn't he get the same thing all the time? I don't know. I don't see it. Maybe it was on mine then that was the case.
Okay.
Challenges, appointments, education, relationship. Okay. No, it must have been on ours then. Okay.
Okay. All right. Because I couldn't figure, I didn't think it was on ours.
Okay. All right. Thank you.
Yes, ma'am.
Miss Karen?
Hello, can you hear me?
Yes, ma'am.
Okay, sorry, I had to figure out how to unmute. I have a question. My son is on now waiver and he just made 30. I've had someone bring something up to me before about a power of attorney. If
Mhm.
something happens to me because I am his employer, and if something was to happen to me, I was told that if I don't have a power of attorney, that he would become a ward of the state. So they said I would have to have a power of attorney and have who the power of attorney will go to if something was to happen to me. So this is new to me because I've never had to do a power of attorney before. And I've been talking to my attorney about it, about getting one made. But I don't know how true that is. And I was wondering if you knew anything about that. You know, if something happened to the only family member, you know, that was there. And if something was to happen to the client, you know, would they become ward of the state? Or could the client, or could it be turned over to someone else without having a power of attorney?
So is your son, is he interdicted? Is there a guardianship? Is he considered competent major?
He's mild to moderate autistic. He's verbal and everything. But
Yeah.
um he could say what he wants and all that, you know.
Yeah, no,
But
I mean, people don't generally automatically become a ward of the state, Miss Karen. If you had, I mean, I'm sure your attorney would be able to share this with you, but if he was interdicted or something of that nature, you would set up who that would turn over to if something happened to you.
okay,
But in general, if something happened and he's able to verbalize, he could really probably tell us kind of, you know what I mean? This or part of planning with your support coordinator for the future, right? This is how
right.
things will look. This is how it will work out. So unless there's something legal in place for that, they would, we don't, to my knowledge, there's not a mechanism that would automatically make somebody a ward of the state. That's not how that typically works. But Miss Karen, it sounds like there's bigger discussion there or questions. So if we need to have further discussion sort of offline, we can work something out to have a conversation or get you connected with somebody who's better able to have that conversation with you.
Okay, okay. And next question. I know you don't know much about the Medicaid. My son has been on legacy Medicaid since he was a baby.
Okay.
And I've come across a situation with his eyes where he needed to go to the eye doctor. And he has um, a second Medicaid that's just for his mental health, which we just switched to Aetna for that, which we're still unsure because we're waiting to hear if they're going to keep Aetna or not. But legacy Medicaid does not cover vision except for medical vision, like if something was wrong. So I was wondering, like, if I've been up in the air with getting rid of the legacy and just going through straight through to a plan, total plan, through Medicaid instead of having the old legacy. It's called old Medicaid that they call legacy. So I was wondering if y'all came across any of that and if that would affect his now waiver if I was to get rid of legacy Medicaid. Because that's what I'm
It-
scared of.
It won't impact his now waiver if you choose to go with a managed care organization for the medical piece of his insurance, Miss Karen.
Okay.
In terms of pros, cons, that sort of thing, I would encourage you to probably talk to somebody in Medicaid, although maybe that's something for my team that we can also ask. Maybe we can see if Medicaid will do a presentation with the group kind of about the differences between legacy and versus the managed care health option. So
Yeah, I'd like,
there shouldn't be an impact, Miss Karen, on your now waiver. You could
okay.
have either or, and it won't impact that.
Okay. Thank you so much.
Sure thing.
Thank you.
All right. Miss Danielle said to please send out requirements. We're gonna, for an electronic signature to help us meet them. We're gonna make sure, Miss Danielle, that we include some information, either in a separate send out or as part of that handbook update that we're doing. So we've got that down that we need to add some information there. All right. I'm looking to my team to make sure that we covered the questions we've received. I think we've gotten to everybody who wanted to talk. And then Miss Karen added, Karen Scallon for Miss Karen Brown. All the plans and legacy are required to provide whatever is in the state plan services. If any one of them does not have a provider that can provide the services, the recipient can change plans under a for-cause reason or change from legacy to the current plan they have for behavioral health. It's good information, Miss Karen. All right. I think we have gotten a lot of feedback, information, and potential topics, action items that we need to follow up on. Miss Carrie, go ahead. Miss Carrie?
Yes, I was interested because the conversation that was earlier about the lady that has a disabled child and with the legal action and stuff, not action, but legal things to do. And I wouldn't mind getting information about that as well because I done got up in age and my daughter is disabled and I don't know which way to roll or what to do.
So maybe a topic or an
Mhm.
opportunity to kind of have somebody with that background speak to those sorts of things. Okay.
Right, and which way to go to do the legal documentation, even if it's to make somebody her legal guardian when I'm gone. See,
Okay.
I don't know like exactly which way to do it or how to get it started.
Okay.
You see what I'm trying to say?
I do. It sounds like really maybe some future planning or some topics around like, you know,
Mm, yeah,
down the road.
really,
Yeah. So I mean,
yeah,
I've got that written down, Miss Carrie.
yeah, 'cause a lot of us
Miss
gonna be
Dawn.
getting to that role at the
Yeah.
end, but we don't know like exactly how to go forward with it and who to contact
Okay.
for the
So how we
information.
plan
Right.
for some of that future
Yeah,
sort of stuff. Yes, ma'am.
correct.
All right, Miss Dawn. Miss Dawn.
I just wanted to respond to the ladies. I have done that before because I have a disabled son.
Okay.
What I did was I did some paperwork with an actual, you don't have to pay that much. You could just pay like $25. And then
Okay.
you will put paperwork in place that will say if something happens to you, a responsible person will take charge of that person when something happens, or in case of emergency, they'll be the person that can take them to the doctor and things like that. So it's
Okay.
not a real difficult task. You can just go to an actual notary and have that paperwork done, and it's called a power of attorney. And when you have that in place, that document is legal and bonded, and that person can use that. And if you want to go further and go through the courts, there is a way that you can go through the courts, but that one is a lengthy process and costs more. But you can go through the courts and authorize someone to be the authorized representative, but you have to legally be the authorized representative yourself first, or the warden through the courts first before you can do that.
Okay. All right. That makes sense. Got you. Oh, they can't hear you, Miss Carey.
All right. Thank you, Ms. Dawn. Miss Karen shared a resource, and so Miss Karen, if you send me an email, I'll make sure we include information with the resource page in this slide deck. Families Helping Family Centers regularly have someone present that can help with legal issues like that. Ms. Karen also shared Disability Rights is also a helpful resource, and they have information on their website. And then Karen gave me several. Miss Karen, I'll make sure I make note of those, so that's helpful. All right. Just gonna give it a second to make sure we don't have any more questions or comments in the question and answer box or any hands. All right. We really, really appreciate everybody joining us today and talking through different options as it relates to how we move forward with this self-direction quarterly group and what would be most useful to you all. We will work on getting information finalized, pulled together, and get that out from today, the materials from today, so that you guys can access that, click on links. We'll add a resource page maybe in the slide deck with some links to some of those resources that Ms. Karen shared and that others shared. Again, we appreciate you all, and we will get information out as quickly as possible regarding maybe save the dates for next year when we're proposing to do those quarterly meetings. Hope everybody has happy holidays, stay warm, and we will talk to you all soon. Thank you all.